Emma. I'm so worried about her.
I know, I don't understand how this happened.
I don't either, and I don't know. Is it something we did?
It
What,
can't be.
what if she can't eat well? And what if people make fun of her? It's just going to be awful. I'm so nervous.
We need to talk to a professional.
We definitely do.
Good morning, Jamie, and good morning, Kelly.
Good morning.
My name is Mary Sanders.
Hi, nice to meet you.
I'm the speech language pathologist here at the hospital. I'm here to talk to you about your daughter and some of the issues she may be having with feeding and speeches as she matures. I have looked over Emma's medical records and I am familiar with her condition. I know you have spoken with your pediatrician, right? Well, I am here to help your daughter with feeding issues that children may have with cleft lip and palate. Are there any questions you have before I begin to explain some feeding methods that will help you?
Well, you know, there is one question. I'm just so worried about her nourishment issues and her being able for us to be able to feed her. You know, I'm just worried that she's going to be malnourished or under nutrition, and I'm just really scared, and I'm so nervous about her choking, and I'm just really scared that she's not going to thrive and she's not going to grow well. It's just really got me scared.
Well, I certainly understand that this may all seem overwhelming for you, but I will try and clarify for you some things we can do to help Emma overcome some special feeding issues children has with cleft lip and palate. I have brought some illustrations along with me to try and explain some basic anatomical issues, so let's take a look, shall we? There you go.
Oh, so that's really how the inside of the mouth looks? Like it's open?
Now, Emma has a unilateral cleft lip palate and the roof of her mouth, or her palate is not completely closed.
Oh, let's see, it's open.
See, it's open. This will give her some difficulty in sucking properly and may cause some drainage in her ears as well. So we need to look at feeding positions and special feeding techniques as well, okay? It is important to hold Emma in an upright position.
Kind of like this?
Just
Hold
like-
it like this?
Yes. Yes, so basically, you have to hold her in an upright position when feeding her. That is to prevent leakage into her nose and also drainage in her ears as well.
It's starting to fall a little bit.
I want to know, how soon can we get her cleft repaired?
Well, just to let you know, I'm not qualified to talk to you about surgery, but I will be more than happy to refer you to a surgeon, and I am sure your medical doctor can address your questions about recommendations for where and when surgery will be advised.
Oh, will she eventually look all right? I'm concerned about her being made fun of her whole life.
Me too.
I understand you have many worries right now, and I just want the best for your child. Your surgeon can answer these questions more specifically, okay? But I have seen many cases where the only thing left visible after the surgeries is a slight scar.
Can I ask you another question?
Sure.
That's really been bothering me. I'm worried about as she grows, you know, that she's going to have problems with her speech. Even if we do the surgery, how's this going to affect her speech later on?
Well, although it is common for children who are born with a cleft to have speech issues at some point in their lives, many children born with a cleft palate develop normal speech by the time they are 5. The speech pathologist you will be working with at the time will evaluate Emma. And she'll also evaluate Emma's progress regularly, so they will be able to remediate these issues early on. Speech therapy can be extremely effective to treat articulation or speech delays.
I don't know why this happened to us, and I really feel like maybe there was something I could have done during the pregnancy, or maybe it's the way, I don't know, the way I've lived my lifestyle.
Honey, don't say that.
I know, but maybe God's trying to punish me. I just don't know. Is this my fault?
Well, I understand that you must be experiencing all sorts of conflicting emotions right now, and that is perfectly normal. But in most cases, the true case of cleft lip and palate isn't known, so you shouldn't blame yourself. We're going to concentrate on getting Emma the help she needs so she can thrive and get proper nourishment, okay?
Okay, so we're gonna be able to go along with you and work with this?
Sure.
You're gonna be here, you're not gonna leave us?
Yes, I am here for you, and I am here for both of you as well.
Thank
And
you.